So we're going to unpack this research paper you shared about what mental health service users really need. And
Yeah.
it's pretty eye-opening stuff. Imagine like going to the doctor for something, a physical problem, and they just won't tell you what's wrong or like how the treatment's supposed to work.
It's a jarring thought, isn't it? And yet, that feeling of being left in the dark is something that a lot of mental health service users experience pretty regularly, according to this study.
Yeah, for
Yeah.
sure. And to be clear, we're diving deep into like a research paper here.
Yeah.
But this isn't about just like dry statistics. This
Yeah.
is about real stories. This research was based on in-depth interviews with 36 people about their actual experiences like navigating the mental health system.
And those voices are what make this research so powerful. We're not just talking about abstract theories of care. We're hearing directly from the people on the receiving end of it.
Exactly. And while some of those experiences are undeniably tough to hear, right? What they reveal is absolutely crucial for building a more humane and effective approach to mental health care.
Which is exactly why we're taking this deep dive.
Okay, cool. So first up, the study finds this really profound sense of disrespect that comes from a lack of information. It's like you work up the courage to seek help, you step into that therapist's office or maybe a hospital room, hoping for some answers, some guidance, some sense of control. But instead of feeling like you're part of the process, you're met with silence. Decisions are being made about you, not with you.
And that's where this idea of disrespect becomes really important, because it's not just about the information itself, it's about what that silence represents in the relationship between the patient and the provider.
Yeah, it's like this unspoken power imbalance.
Precisely. And that imbalance can really undermine a patient's sense of agency right from the start.
Yeah, and the study actually shared a really poignant example of this. One participant, interviewee 22, she was struggling with an eating disorder, and she felt totally blindsided by the lack of explanation she received about her diagnosis and treatment plan. It was almost as if she was just expected to blindly trust a system that wasn't even willing to be transparent with her.
It's a striking example of how the withholding of information can be perceived by the patient as deeply disrespectful, even if that's not the intention. It creates this barrier to building a trusting and collaborative therapeutic relationship.
Yeah, and it makes you think, what if we flip the script? Imagine if from that very first appointment, patients felt empowered to ask questions, to understand their diagnosis, and to be seen as active participants in their own mental health journey. How much of a difference do you think that would make?
I think that shift in dynamic is crucial, because when patients feel heard, understood, and involved in their own care, it can dramatically impact their sense of agency and their overall well-being. It really is. And that actually leads us to another fascinating insight from this study. When faced with this wall of silence, right? Many people don't just passively accept it. They become what the study calls researcher patients.
Okay, I love that term, researcher patients. Tell me more about what that looks like.
So essentially, these are individuals who, when confronted with a lack of information from their healthcare providers, they kind of take it upon themselves to become experts in their own right. They dive headfirst into books, online forums, you name it, anything, to try and understand what they're going through.
So they're almost forced to choose between being a passive recipient of care or becoming, in a sense, amateur researchers on top of everything else they're dealing with. I mean, is that sustainable?
That's a very good question. On the one hand, it's inspiring to see this thirst for knowledge and this proactive approach to one's own well-being. But it also highlights a system that often fails to prioritize patient education as a core component of care. And you're right, expecting individuals to fill that gap themselves, while admirable, isn't a realistic long-term solution.
Yeah, and I imagine this dynamic, this researcher-patient phenomenon, probably creates some interesting power struggles within the traditional healthcare hierarchy.
Absolutely.
Yeah.
The study actually touches on this, particularly with one participant interviewee too. She felt like her psychiatrist was very open to her self-advocacy and treated her like an equal partner in her care. However, she often felt as though other healthcare professionals were almost resentful of her for coming in armed with information. It challenged that traditional dynamic.
Which is interesting because ideally, wouldn't you want a healthcare system that embraces and encourages that kind of patient engagement?
Absolutely. And I think that speaks to the broader need for a system that values collaboration and shared decision-making. One where a patient's research is seen as an asset, not a threat.
Yeah, it's almost like we need a system-wide evolution in how we think about the patient-provider relationship.
Yes.
And speaking of systemic issues, this research also shines a light on another major barrier: Stigma.
Yes, absolutely.
Yeah.
The study found that stigma creates this really difficult catch-22 situation for many people when it comes to information seeking.
How so?
Well, on the one hand, people are often hesitant to ask for information about mental health challenges because they're afraid of being judged. But on the other hand, that lack of open conversation just perpetuates a cycle of silence and shame, which only reinforces the stigma.
Right, it's like this self-fulfilling prophecy. And sadly, I think that experience resonates with a lot of people. One story that really stuck out to me from this study was interviewee 15. She talked about how she would avoid even picking up pamphlets about mental health at her doctor's office because she was so worried about what other people in the waiting room might think.
It's a heartbreaking example of how deeply ingrained the fear of judgment can be.
Yeah, and she actually said that she felt safer seeking information online where there was at least a degree of anonymity. It makes you wonder, even with physical resources available, how much does that fear keep people from actually reaching out for help?
And highlights this fundamental disparity in how we view mental health compared to physical health.
Hmm.
It's almost as if there's this unspoken societal rule that mental health is somehow less legitimate, less deserving of open discussion and support.
Which is such a shame because, as we know, mental health is so fundamental to our overall well-being. It impacts every single aspect of our lives. So how do we even begin to bridge that gap? How do we create a space where seeking mental health information is as normal and accepted as researching a physical ailment?
That's the million-dollar question, isn't it? It requires a fundamental shift in societal attitudes and beliefs.
And I think it also requires healthcare systems to become much more proactive and sensitive in how they provide information and create a welcoming environment for those seeking help.
I completely agree. And that's where this final theme from the study becomes particularly relevant, the power of shared experiences and the importance of what we might call the Me Too moment in mental health.
The Me Too moment in mental health, I like that.
Yeah.
Tell me more about what the study revealed about the role of shared experiences.
Yeah, so this was actually one of the most powerful findings in the research. They discovered that for many participants, some of the most valuable information they received actually came from hearing the stories of others who had gone through similar challenges. It provided a sense of validation, hope, and importantly, a feeling of community.
Like you're not alone in this struggle.
Exactly. And that sense of shared experience can be incredibly powerful, especially for those who may have been grappling with these challenges in isolation for a long time.
Yeah, there was a quote from one of the participants, interviewee 3, that really stuck with me. She talked about how the people she met in support groups and through reading personal accounts, they just got it in a way that others didn't. They understood her experience on a deeper level because they'd walked a similar path.
Yeah, that sense of being truly seen and heard of, not having to explain or justify your experience, can be profoundly therapeutic in and of itself.
It makes you wonder, though, why this kind of peer support is often relegated to these more informal spaces? Shouldn't it be a more integral part of mainstream mental health care systems?
That's a question more and more people are asking, and for good reason. Imagine a system where, alongside traditional therapy and medication, there's dedicated space for people to connect with others, share their stories, and draw strengths from a community that understands their experience. It could be a game changer.
Totally. It feels like what we're really talking about here is a fundamental restructuring of how we approach mental health care altogether. Moving away from a model solely focused on treatment and moving towards one that prioritizes support empowerment and the recognition that lived experience holds immense value.
Absolutely. And what I find so compelling about this research is that it provides a potential roadmap for that shift. And it's a roadmap informed by the individuals who know this system best, the service users themselves.
Okay, so let's take a step back for a second and recap what we've learned from this deep dive. Because this wasn't just about dissecting some dry research paper. It was about gaining a deeper understanding of the lived realities of navigating the mental health system.
And those lived realities revealed some pretty clear takeaways.
Yeah, we talked about the profound sense of disrespect that can come from a lack of information, the rise of what the researchers brilliantly termed the researcher patient, the persistent barrier of stigma, and of course the undeniable power of shared experiences.
Each of these themes highlighting the urgent need for a more humane, transparent, and patient-centered approach to mental health care.
What's striking to me is that this research was published nearly 2 decades ago. It makes you wonder, how much progress have we really made in addressing these issues? Especially now in the age of the internet, where information, both accurate and inaccurate, is so readily available.
It's a double-edged sword, isn't it? On the one hand, the internet has democratized access to information about mental health. You can find support groups, personal stories, even diagnostic criteria with just a few clicks.
Which can be incredibly empowering for those who might otherwise struggle to access those resources.
Exactly.
Yeah.
But as you pointed out, there's also a proliferation of misinformation online, which can be incredibly damaging, especially for someone who is already feeling vulnerable.
So it becomes even more crucial for us to equip people with the tools to critically evaluate the information they encounter, to help them navigate that digital landscape safely and effectively.
I think that's a great point to end on. It's not enough to simply advocate for more information. We need to empower individuals to become informed consumers of that information, to engage with it critically, and to seek out diverse and trustworthy sources.
You've given us a lot to think about today. Perhaps the biggest takeaway for me is that we should never underestimate the power of listening to the voices of those with lived experience. Their insights are absolutely invaluable as we work towards building a more just, compassionate, and effective mental health system for everyone.